Hello, everyone. I'm Dr. Rosa Stakes, and today we're diving into a topic that many men might overlook, but is incredibly important. Your penis is trying to tell you something. It's a crucial part of your body's communication system, sending signals that you shouldn't ignore. Your body has a way of letting you know when something isn't quite right, and your penis can be one of the earliest indicators of health issues that need attention. Have you ever noticed any unusual changes or symptoms and wondered what they might mean? Maybe you've seen something different in color, felt some discomfort, or noticed something that just doesn't feel normal. These aren't signs to brush off. Paying attention to these changes can help you catch potential problems early before they develop into something more serious. I want to invite you to think about your own experiences. Have you ever felt unsure about something related to your sexual health? Perhaps you noticed a small lump, a change in shape, or something else that raised concerns. You're not alone. Many men experience this, but might feel hesitant to talk about it or seek help. That's why I'm here, to provide clear professional information and to encourage open conversations about these important health signals. You might be wondering, what exactly should I be looking for? It's normal to be curious and sometimes even worried. That's a good thing because awareness is the first step toward taking control of your health. If you've ever noticed any persistent pain, unusual lumps, discoloration, or strange discharge, those are all signs that your body might be trying to communicate something important. These symptoms can be indicators of infections, circulatory problems, or in rare cases, more serious conditions like penile cancer. Sometimes the signals can be subtle, and you might not notice them right away. That's why regular self-examinations and being mindful of any changes are so important. If something feels different or unusual, it's worth paying attention to. Remember, your penis is not just a sexual organ, it's also a window into your overall health. Let me ask you again, have you ever experienced any symptoms that made you stop and think? Maybe you felt discomfort during an erection, noticed a change in color, or saw a sore that didn't heal. These are not things to ignore or feel embarrassed about. They are your body's way of asking for help. If you feel comfortable, share your experiences or questions in the comments below. I'm here to listen and provide guidance because understanding these signs can empower you to take better care of yourself. Many men don't realize that erectile dysfunction or difficulty achieving or maintaining an erection can be an early warning sign of other health issues. It might seem like just a sexual problem, but it often points to underlying conditions such as cardiovascular disease or diabetes. These are serious health concerns that require attention. So if you notice changes in your erectile function, it's important to consider the bigger picture of your health and reach out to a healthcare professional. I know that talking about these topics can be uncomfortable, but it's vital to approach them with openness and honesty. The better you understand what your body is telling you, the better you can protect your health. Early detection and treatment make a significant difference in outcomes. You deserve to live a healthy, fulfilling life, and that starts with listening to your body's signals. So, as we begin this conversation, I encourage you to stay curious and proactive. Don't dismiss changes or symptoms as just normal or something that will go away on its own. Sometimes they won't, and catching them early can save you from more serious complications down the road. If you're wondering how to perform a self-exam or what specific signs to watch for, we'll cover that soon. But for now, just take a moment to reflect on your own experiences. How often do you pay attention to your penile health? Have you noticed anything unusual lately? Your awareness and willingness to learn are the first steps toward better health. Remember, you're not alone in this. Many men face similar concerns, but don't always know where to turn. That's why I'm here, to provide clear, accurate information and to create a space where these important topics can be discussed without judgment. Feel free to share your thoughts or questions below. Your input could help others who might be hesitant to speak up. Together, we can break the stigma and promote a better understanding of men's health. Keep in mind that taking care of your sexual health is an essential part of your overall well-being. It's not just about physical function, but about your confidence, relationships, and quality of life. When you listen to your body's signals and act on them, you're investing in a healthier future. So let's keep this conversation going. Have you noticed any changes that made you curious or concerned? What questions do you have about penile health or the signs your body might be sending? I'm here to help you understand what's going on and guide you toward the right steps for your health. Your body is sending you messages every day. Sometimes those messages come from places you might not expect, like your penis. Don't ignore them. Pay attention, be proactive, and remember that help is available when you need it. Thank you for joining me today. I look forward to hearing your stories and questions. Together, we can make sure these important health signals don't go unnoticed. Now let's get into what these signs could be telling you. Changes like persistent pain, lumps, discoloration, or unusual discharge are not something to ignore. These symptoms may seem minor at first, but they can point to infections, circulatory problems, or even more serious conditions such as penile cancer. Understanding these signs can help you seek timely medical advice and protect your health. Persistent pain in the penis is a red flag. It might feel like a dull ache or sharp discomfort that doesn't go away. This pain could be due to infections like balanitis or sexually transmitted infections, but it could also indicate other issues such as Peyronie's disease, where scar tissue develops inside the penis and causes curvature and pain. If you experience ongoing pain, it's important not to dismiss it or hope it will resolve on its own. Early evaluation by a healthcare provider can lead to effective treatment. Lumps or bumps on the penis are another sign to watch for. While some lumps might be harmless, such as cysts or swollen lymph nodes, others could be signs of more serious problems. For example, penile cancer often starts as a small, painless lump or sore that doesn't heal. It's rare but critical to catch early. If you notice any unusual lumps, especially if they grow, change color, or are accompanied by other symptoms, you should get them checked promptly. Discoloration or changes in the skin tone of the penis can also be a warning sign. You might see redness, dark spots, or patches that look different from the surrounding skin. These changes could be caused by infections, inflammatory conditions, or vascular issues affecting blood flow. In some cases, discoloration may indicate a precancerous condition or even cancer itself. Keep an eye out for any areas that look unusual or that don't return to normal after a short period. Unusual discharge from the penis is another important signal. It might be a clear, cloudy, yellow, or greenish fluid that leaks without sexual arousal or urination. Discharge often points to infections like gonorrhea or chlamydia, which require prompt treatment to prevent complications. If you notice any discharge, especially if it's accompanied by burning during urination or swelling, seek medical care right away. Erectile dysfunction, or difficulty getting or maintaining an erection, is a common concern but can be more than a sexual health issue. While it's natural to experience occasional difficulties, persistent erectile dysfunction can be an early sign of cardiovascular disease or diabetes. These conditions affect blood flow and nerve function, which are essential for erections. If you find that erectile dysfunction is happening regularly, it's important to look beyond the symptom itself and evaluate your overall health. Addressing these underlying issues early can reduce your risk of heart attacks, strokes, and other serious complications. It's also worth mentioning that infections or inflammation in the urinary or reproductive tract can cause swelling, redness, or tenderness in the penis. These symptoms might be accompanied by fever or general discomfort. Ignoring these signs can lead to more severe infections or complications. Early diagnosis and treatment with appropriate antibiotics or other therapies can prevent progression and protect your health. When it comes to penile cancer, although it's rare, the consequences of late diagnosis can be severe. That's why awareness and early detection are so crucial. Penile cancer typically presents as a sore, lump, or ulcer that doesn't heal within a few weeks. It may be painless initially, but can become painful as it progresses. If you notice any persistent lesions or changes in the skin, don't delay seeking evaluation. Early treatment can be highly effective and may prevent the need for more invasive procedures. It's important to remember that many of these symptoms share similar appearances with less serious conditions. That's why professional medical assessment is essential. Self-diagnosis can be misleading and delay appropriate care. A healthcare provider can conduct a thorough examination, order necessary tests, and provide an accurate diagnosis. If you notice any of these warning signs, don't hesitate to consult a healthcare professional. Early detection and treatment can make a significant difference in your overall health and quality of life. Avoiding or delaying medical advice out of embarrassment or fear can lead to worsening symptoms and more complicated treatments. Taking care of your sexual health is an important part of your well-being. It's not just about function, but about understanding what your body is telling you. By paying attention to these signals and acting on them, you're investing in your health and future. If you have questions about any of these symptoms or want to learn more about how to monitor your penile health, feel free to ask. Being informed empowers you to make the right decisions and seek care when needed. Remember, your penis is more than just a sexual organ. It's a vital part of your body that can reveal much about your overall health. Listening to its signals and responding appropriately can help you maintain good health and prevent serious problems. Stay tuned as we continue to explore ways to recognize these signs early and what steps you can take to protect your health. Your awareness and proactive approach are key to maintaining not just sexual health, but your overall well-being.